right, so I see most folks are in and settled here, so we're going to go ahead and get started just because I know we have a lot of content to cover today, so we want to make sure we have plenty of time. So welcome. This is the second webinar in a three-part series about mitigating burnout and maintaining provider satisfaction during vaccination rollouts. Today, we're really going to dive into the nursing workforce at health centers and talk about the ways in which we can support RNs, NPs, other nursing staff during this time. And we're going to be joined by some special guests from a health center in Philadelphia who are going to share their experience and their story. So my name is Emily Kane. I'm going to be doing a little bit of a didactic portion for you today, just about burnout. I'm also going to introduce an upcoming, forthcoming paper that ACU, the Star Center, and NNCC worked on together. And NNCC, for those of you who aren't familiar, we are a membership organization. We support nurse-led care and nurses at the front lines of care. We provide a lot of different services, including training and technical assistance. And we also have some client-facing services here in the Philadelphia area with our nurses here in West Philly, South Philly, and Fishtown. So we're in a Zoom meeting today, which means we have a couple options. You may or may not be able to unmute yourself just given the meeting settings, but you should be able to turn your video on and off. Certainly the chat is available to you to ask questions. That will be our sort of question pod for today. And I'll also be using in my presentation some prompts for you to write into the chat and share some thoughts. So I'd really like you to, when those kind of pop up on your screen, take a moment to do those chat prompts. So today we really have three learning objectives. We want to identify some potential causes of burnout among the nursing workforce, particularly as a result of COVID-19. We're going to learn about some of the challenges and successes from a nurse-led health center in Philadelphia, and I'll introduce our colleagues from FPCN later on. And then finally, we're going to describe some strategies to mitigate burnout among nurses and other staff. So we are sort of we're going to take a deep dive, like I said, into the nursing workforce and discuss, again, just some of the unique considerations about burnout and satisfaction for nurse practitioners, RNs, and certified nurse midwives, although a lot of our didactic portion today will be focused on NPs, our nurse practitioners. So what is burnout? We've all felt it, or at least seen it among our colleagues, friends, or family. I experience it as a kind of almost a resigned exhaustion, just a complete numbness that dulls each task and makes it difficult to get excited about the work at hand. And you might all have your own experiences of what burnout feels like. And we can feel burnout for a few days, a few months, or even a few years, depending. And not surprisingly, it is essentially, especially prevalent in the healthcare community. Though, of course, I think it has different effects depending on someone's occupation and their setting in the healthcare space. For example, studies show that nurses in hospitals or ICU settings have higher rates of burnout than nurses in primary care to a large extent. But what makes nursing burnout unique across the board? I've provided a definition of burnout here from a 2017 study of Jordanian nurses, and identifies burnout as a reduction in nurses' energy that manifests in emotional exhaustion, lack of motivation, and feelings of frustration that may lead to reductions in work efficacy. Nursing burnout, I think, is especially problematic and troubling because, as we all know, the healthcare system, including community health centers, relies heavily on nurses to provide critical services to patients. Think about your own organization. What would your health center be like without RNs? Could physicians and other providers work at the top of their license without NPs or certified nurse midwives? So really, without the nursing workforce, primary care comes to a grinding halt. And that's why burnout among our nursing staff is so critically important, especially as we continue to deal with and grapple with the pandemic. Well, let's take a closer look at the effects of nursing burnout. This graphic illustrates the cycle of burnout among nurses and the negative implications for patient safety and quality of care. The nursing shortage and inadequate staffing issues stem in part from the aging nursing workforce and general US population. The US Census Bureau reported that by 2030, 82 million US residents would be 65 and older, requiring a significant increase in healthcare personnel and capacity. Meanwhile, some studies report that nearly 40% of registered nurses are over the age of 50. So these demographics don't really bode well for the increased demand we expect to see in the future, let alone the demand we experienced during COVID-19. Whatever the cause of nursing shortages and turnover, inadequate staffing, along with the expectation to do more with less and serve patients with high acuity, are leading to job dissatisfaction and burnout. And depending on location and specialty, the average RN turnover rate ranges from around 9%, 8.8%, to as high as 37%. For NPs, the latest data I was able to find suggests that the turnover rate is around 13%, which is actually higher than physicians. So burnout and turnover among nurses of all types puts pressure on the healthcare system and is conclusively linked to poor patient outcomes. So I want to take a moment to pause here and just reflect a little bit. In the chat, please share whether you've noticed a difference in burnout between nursing staff and other health center staff. So don't try not to think about this in relation to COVID-19, but in your general everyday practice. In the chat, is there a difference, in your opinion, in burnout between nursing staff and other health center staff? So go ahead and in the chat, just briefly share whether you've been able to notice that. I don't see anything in the chat yet, but I know you guys can hopefully have access to that. MA seems to be most effective. That's really interesting, Tamara. And I wonder if we're going to go into some reasons and causes for burnout among nursing staff. And I wonder if something similar, you could think about whether that's similar to maybe some of the causes that you see for MAs, but that is really interesting. MAs are, yes, great. We'll continue to share in the chat, and I'm really curious to see if it is something that you've noticed, and something that you can think about even without beyond COVID-19, right? Just in your everyday general practice. We'll obviously get into a little bit more about what COVID-19 has brought to the table, certainly. So how do we assess for burnout and hopefully prevent turnover? I've listed some ideas here, including regular staff satisfaction surveys, an analysis of turnover rates, and exit interviews. And I also listed the Maslach Burnout Inventory, which is an evidence-based tool that assesses burnout using 3 domains: emotional exhaustion, high depersonalization and cynicism, and low personal accomplishment. So we might find aspects of one or more of these domains familiar immediately, right? Emotional exhaustion refers to the physical feeling of burnout, when energy is low and fatigue or even depression might set in. Depersonalization refers to the detachment some of us might feel when we're burnt out, right? It also might result in a disregard for our patients or colleagues, or just a lack of caring about the quality of our work. We're so burnt out that it's just difficult to muster that care. And finally, low personal accomplishment manifests sort of as low self-esteem or a feeling that our work isn't good enough. And a high score in any one of these domains using the burnout inventory may indicate that an employee is experiencing burnout and could potentially quit as a result. So this is going to bring us to our first poll. Have you done a formal assessment to measure burnout? And again, it could be any number of the things that I just talked about: exit interviews, turnover rates, or even doing like an inventory, maybe a more formal assessment. Mariah is going to give everyone about 10 more seconds or so, and then we will share these results and see. Meanwhile, let me just pop back into the chat. See quite a bit of burnout equally throughout the staff. So that's just really interesting. hopefully you're going to see some similarities between the causes of this burnout between nurses and your other staff. Okay, great. Thanks for doing this poll. Looks like we have our results up here. So most of us haven't done a formal assessment to measure burnout. Some of us have, and I would love to hear in the chat what exactly you have done. I think that would be really interesting. And then some of us aren't sure. Maybe it's been done, but maybe maybe we weren't involved. Am I asking about assessing nurses in particular? Nope, I'm just asking Karen about really any level of burnout among the staff. So could be nurses, could be said MAs, could be physicians. We do conduct exit interviews when employees agree to be interviewed. That's great, Shamara. Yeah, I think that's not necessarily, maybe that's not a formal assessment, but it definitely is a way to measure what are some of the reasons that this employee shared that, that they're leaving, why, can we prevent something like this in the future? Good, great. Thank you, Carrie. Thanks for sharing that. So most of the research around burnout and turnover in nursing, anyway, has focused on RNs in hospital settings. And while there are some studies about NPs and nursing in primary care, very little focuses on the challenges faced by NPs in community health centers. Community health centers, as you all know, serve patients with a variety of clinical needs, as well as complex social determinants of health. Most health center patients are uninsured, underinsured, or receive coverage through Medicaid, and many require an array of services beyond primary health care to achieve optimal health outcomes. Health centers are increasingly utilizing nurse practitioners to fill the care gaps faced by many of these patients. In fact, we took a look at this. The workforce has increased. The workforce of nurse practitioners at FQHCs has increased by close to 16% from 2017 to 2019, nearly doubling the rate of physician growth in that domain. So it's really important that we look at this and make sure that we're preventing burnout among our nurse practitioners as much as possible. So to understand the causes of NP burnout in health centers, ACU and NNCC, we interviewed 5 practicing NPs, 4 health center leaders, and we also reviewed some of the available literature to define the role of NPs in primary care. And again, this is really outside of COVID-19, but just thinking about some of the typical causes of burnout and how COVID-19 has perhaps exacerbated them or changed them in any way. So when we interviewed our focus group members, we found a few key drivers of burnout among NPs in health centers. Many of these drivers depended on an NP's level of experience. Younger providers who were just entering the workforce sometimes struggled with feeling underprepared, especially those NPs who did not previously work as RNs. That was a really critical key distinction that we found. This feeling was exacerbated by the high acuity of many health center patients. I pulled a quote from one of our participants here, which you can read on the slide, that kind of speaks to that a little bit. And as we discussed earlier, health center patients often have complex needs. Many novice nurse practitioners feel underprepared for the level of acuity they see. Some of the focus group members also expressed an inability to turn off at the end of the day, especially if they have other responsibilities at the health center, on committees, or in leadership roles. And thinking back on the burnout graphic we saw earlier, we know that providers experiencing burnout struggle with their self-perceived skill level, right? So the NPs we interviewed also felt this way, especially if they didn't see progress with their patients over time. And finally, the lack of support was a key driver of burnout. And our focus group members, when they talked about lack of support, they referred to just needing better educational preparation, needing dedicated time with clinical mentors, and more time to see and work with complex patients, just some organizational support in that way. So another chat prompt for you. And since many of you said that you're seeing a lot of burnout kind of equally among staff, these may or may not resonate with you for everyone. So do these causes of burnout resonate with your health center? How does this compare with causes of burnout among other staff, other nursing staff, RNs? But you can really feel free to kind of talk about it. How does it compare with everyone that every staff member at your health center? And I just went back to the slides so you can again see this list of potential causes. And does this sort of resonate with you? If not, what's missing here, right? What's missing on this list that you feel we should kind of take a look at? And feel free to share in the chat. Yes, similar across the board. Thanks, Terea. Yeah, continue to share in the chat and just sort of take a look at these, see if they ring true for you. And if something's missing, we'd really like to know. What do you think is not Flo saying all the above? Yeah. What do you think is not here that you feel like should be represented? Great, thank you. So we've discussed some of the causes of burnout, right? But we also asked our focus group members about potential solutions. And so over the next few slides, I've laid out the recommendations from the white paper, which we don't have published yet. We will very, very soon, hopefully, and we'll have that ready and out on the World Wide Web for you to look at. But these recommendations are based on what our participants shared and also some of the things that we found in the literature. First, so we identified some supports for those novice NPs, those NPs who are early in their career. Many of the focus group members advocated for paid nurse residency programs. Residency programs can help bridge the gap that some novice NPs face between their formal education and entering the workforce. They also suggested that new nurse practitioners be given smaller, manageable caseloads that gradually build up with more experience. And in addition to smaller caseloads, focus group members thought that a mentor, preferably a more experienced NP, could help provide some of the support cited as a driver of burnout. And finally, these focus group members also shared that it was very difficult to try and find time between patients for senior clinicians to provide feedback and oversight. So providing that structured time, even if it's, a huddle in the morning or a weekly meeting or something like that, that structured time can really help mitigate scheduling conflicts. And depending on where you are in your state, some NPs might have to have partnerships with physicians or other providers, and really having that ability on the organizational level to set time aside for that to happen can be really, really critical and helpful. So what about more experienced NPs? Unlike novice NPs, seasoned NPs experience burnout when their roles are unnecessarily restricted or not understood. So risk of burnout is high when a person doesn't feel their role is appreciated or that they are really given the opportunity to practice at the top of their license, the top of their skill. So outlining the specific roles and responsibilities of NPs and other nursing staff can be a valuable component of the onboarding process for new staff and might mitigate this concern. So when new staff join the organization, they understand how everyone fits in, what the different providers are doing. Nurse practitioners can feel that they really are part of that team and are understood and appreciated. And health centers should also encourage NPs to practice at the top of their license, like we sort of mentioned, reducing administrative tasks when possible and allowing for greater time with patients. This also means that NPs should be included in driving the mission and vision of the health center and invited to participate in organizational decisions. And NPs also thrive when good work is recognized by both patients and their colleagues, although I would argue that that's true for all of our health center staff, that when we really do recognize high performance, we shout out those great moments, that really does help drive satisfaction. Let's get one there. And then finally, we looked at the role of nurse leaders. Many NPs serve in leadership positions at their health centers while still practicing. And so it's important to set clear boundaries, respect time off of work, and make sure that the same people aren't tapped again and again to lead projects, that there really is an opportunity for them to turn off at the end of the day, right? Another crucial consideration for health centers is to make sure that NPs are compensated equally for equal work, especially in that leadership realm, right? So if nurse leaders aren't offered the same salaries as their physician counterparts, they might not feel as valued or respected by the organization, which in turn can also lead to burnout. So all the things that we've discussed, right, from our white paper and just in general, are just, again, general considerations during typical practice. They don't even scratch the surface of burnout during COVID-19. COVID-19 exacerbated many of the burnout concerns raised in this white paper and other research. And the pandemic has really raised new issues as well, including fear of bringing the disease home to family members. Many nurses report feeling an unprecedented level of stress with seemingly no end in sight, right? Over this past year, health centers have had They've been tasked with quickly onboarding telehealth, running testing sites for COVID, continuing to provide primary care services for patients. And now with vaccine rollout well underway, health center nurses especially are feeling like it's just one more monumental task being replaced by another. And so this brings us to our next poll. What has been the biggest cause of burnout among your nursing staff during COVID-19? You might not exactly know, but if you were to guess and just pick one that resonates the most. If you feel like there are others that aren't listed here, I'd love to hear that in the chat. If there's another cause that you feel has really impacted your nursing staff during COVID-19. So let's give everyone a couple seconds to do that, and then we're going to see these results as well. All right, Mariah, what do we have here? Yeah, I think that's not surprising. And, stress and exhaustion have been widely reported, right? And I think, obviously this isn't just our nurses. This is really everyone in our health center, but nurses have so many different roles and responsibilities. I think MAs probably similarly, as you all mentioned earlier, we're seeing that stress and exhaustion is taking a huge toll. And then Tamara saying we've been critically short-staffed. And of course, that's, definitely does not help everyone feel like they can even do their own job at the top to the best of their ability if they're not, if they don't have their colleagues to help and support. Oh yeah, taking the weight of patient frustration and same issue, short-staffed, right? So really important considerations. Great, thanks for sharing all of that. So we're going to hear more about this particular issue and this topic. We're going to hear about the experience of the health center nursing workforce during the pandemic from the field, as we say here. So with this, I'm actually going to turn it over to our colleagues from the Family Practice and Counseling Network in Philadelphia. Dr. Mary Thornton-Bomer, she is the lead nurse practitioner, primary care coordinator at Family Practice and Counseling Network. And then we have Terea Gibson. She's the clinical care manager RN at FPCN as well. So I'm going to stop sharing my screen. I'm going to have Terea share her screen, and we're going to do a deep dive into some of these causes and concerns of burnout in COVID-19.
Okay, Mary, I think can you see my screen, everyone?
Yes, I can see.
Yes, we can see.
You can get started.
Good afternoon, everyone, and thank you for giving me this opportunity to speak on this topic. So I am just going to give you an overview of our organization, the Family Practice and Counsel Network, in partnership with the Stephen and Sandra Scheller 11th Street Family Health Services, started with two nurses, a nurse practitioner, Dinah Teresi, and a public health nurse, Patricia Garrity. There are two nurses with the same vision, and their vision was to ensure that the unrecognized, undervalued population in the city of Philadelphia living in public housing are treated equitable with dignity and respect and have access to quality health care. And Donna's motto has always been that quality health care is a right, not a privilege. So in 1992, Donna Teresi, she was able to get a grant from HRSA to start the first health center. The first health center was at Abbotsford Public Health Housing Development. And she started off in a converted apartment with only one exam room. And then in 2002, Patty Garrity came to Donna with the same vision to have the health center in another part of Philadelphia, in the North Philadelphia area. So it was originally operated by Drexel University School of Nursing. And then, like I said, in 2002, they joined forces and it became 11th Street Family Health Services in partnership with Family Practice and Counsel Network. So not yet, Taria, I'm not finished. So 11th Street, we were a small building, and in 2015, we were able to expand our services to the community with a generous financial grant from the Schellers Foundation. So that's why we're named the Stephen and Sandra Scheller 11th Street Family Health Services of Drexel University in partnership with Family Practice and Counsel Network, which is a mouthful. So, and again, we target residents, the community who live in 4 housing developments within the 11th Street corridor. The Family Practice and Counsel Network, we provide personal center integrated and comprehensive health services to individuals and families across the lifespan. We provide services to all of the communities. I think we cover just about all the neighborhoods in Philadelphia. So we, in addition to 11th Street, Family Practice and Counsel manages 2 other health centers. And Abbotsford Falls, which I mentioned, has expanded. It's not in the 1 apartment room anymore. And also we have a larger health center in the southwest part of Philadelphia. Okay, so the network-wide, we serve around 22,000 patients a year. And we are a certified patient center medical home. At 11th Street, 100 patients in the 4 housing developments, as I already mentioned. You can advance. So the staff consists of family nurse practitioners. We do not have any physicians who work at the site. We do have to have collaborative physicians who are off-site and available when we need them. So we have about 6 full-time nurse practitioners, family nurse practitioners, 2 full-time registered nurses, which is our clinical managers, as well as our clinical nurses. We have about 7 certified nursing medical assistants, and I did hear several people mention that they have been challenged with staff. So have we. We've already challenged, and then we had 2 of our medical assistants recently go on maternity leave. We have a full-time psychiatric nurse practitioner who's also on maternity leave, and we have our pediatric behavioral health consultant who recently returned from maternity leave. So I guess these are COVID babies. And we have an adult behavioral health consultant, an addictions counselor, because we do provide medical assistant treatment to opioid use disorders. We have a practice manager, a patient service representatives. We have 3 of those who are our front desk team. We are in need of a nutritionist. We have a social worker, community health worker, medical records clerk, care coordinator. We have a AmeriCorps worker, and we have a Drexel co-op student, which is a registered nurse student. And we do have a part-time attorney who is available 2 days a week.
Hi, everyone. As I mentioned, my name is Taria Gibson. I'm the clinical care manager at 11th Street. And I just wanted to talk a little bit about the challenges we've been facing since the COVID-19 pandemic. And as you can see listed here, but one of the things we started out with is self-care. So in general, Unfortunately, some of the things that we normally have the opportunity and the access to in the building for self-care. So for example, we do have a gym in the building. Our mind body team would often provide, well, on a regular basis, will provide staff classes. So we would have mind body meditation, we would have yoga, and a couple of just other times and opportunities to, provide self-care. And so those things have been unable to access. They've only been virtual. So unfortunately, some people don't have time to do it virtually, even though they would be able to do it in the building. So that was one thing. And then the other thing is just in general, finding time for self-care. Just because of the times of COVID, there seems to be so much more to be done, or the focus is a little bit changed. So people don't take that opportunity or that time as they normally would to provide self-care. And we did like to work together as a group to help and encourage each other with self-care activities. But as I go to the next one, team cohesion. So in relation to that, because the staff is staggered, just because we do have close working quarters, so we alternate days for some staff. So therefore, that same cohesion and that same support to encourage each other to do self-care activities has diminished. And then also just the lack of maybe team building and support activities. We did like to do a lot of social gatherings for different events, whether it's holidays or just general, because, sometimes we'll see that staff morale is low and we'll plan an event for, some sort of social gathering. We love to eat and bring different foods in. So that's something that we used to do all the time. So yeah, now someone will just bring one thing in and leave it in one space and everybody can, who's here can, go for it, but it's definitely not the same as it was before. We talked about compassion fatigue. So definitely, if you look at the picture, I feel like I'm already tired tomorrow. So yeah, you talked about it in your presentation, Emily, that there's really no end in sight. So that's what makes it difficult. Though we do have obviously the vaccine and we're working on that, there's still really no clear cut on when things will, slow down and become more normal-like as they were in the past. And just so also essential workers. So the difference between in our office, some like the RNs, the NPs, we're always in the office. We may alternate days, but we're always here. We do have a lot of staff who are 100% remote as well. So that makes it, difficult. Some of the staff that were here before are some of the staff that was support staff that we would go to, like for immediate assistance that we needed. But a lot of that staff is now working from home, so we don't have that access as we did before. We'll have to, send a message and wait for that reply, which is a lot different than, having someone right in the office to be able to help when needed. Also frustration, we talked about staff frustration, patient frustration. So a lot of that stems from, I would say, we talked about it, and you talked about it previously, Emily, but maybe some unclear roles. So because, COVID is novel, there is some unclear roles that were set forth, but a lot of us just fill in, but that's where the exhaustion comes in, because it's some of the same people filling in as needed. And for frustration, as far as patients, some of them really appreciate and love the virtual visits. And then there's the others that are used to seeing their providers and they don't necessarily want to talk with their providers. They want to get into the office and see those providers. And then communication is the issue. We have some patients that can't read and write. It's difficult for them. So telling them some things over the phone and expecting them to be able to follow up is difficult. So having them, in the office where we can, help them out, print things out for them and give it to them is, better for them. So that's part of the frustration. And then just communication in general. The phone systems are overloaded because patients aren't coming into the office. So they're trying to call. We do have a lot of patients just walking in because they can't get in through the phone. So that's causing additional frustration. And then finally here we have just morale in general. So being in office where you're used to, a whole crew of people, one person can come in, not in the best mood. But if there's a whole group of other people, to provide support or in, a good mood and a healthy space, it changes things. Now there's like 3 or 4 people in the office. If one person comes in and they're not in the best mood, it can rub off on others, or you can just see it. Whereas before, things were a little totally different. Also, enthusiasm in general. Again, when you talk about burnout and just being exhausted from doing other things, sometimes there's just a lack of enthusiasm. As you mentioned, let's see. Okay, you mentioned like tapping into the same staff. So we did talk about that, but we wanted to just talk a little bit about emotional exhaustion. So though we're, excited that we're able to test as many people as we are for COVID, we're excited that we're able to vaccinate as many people as we are. It gets difficult when it's some of the same staff, because we talked about the, turnover rate. So, and that's it for now. I'm actually going to pass it back to Mary so she can discuss the next slides.
Okay, so some recommendations for solutions that we try to implement. First of all, I just want to say we just all need to just take a deep breath. Take a deep breath and just live in the moment, because things are just so chaotic most of the time, where we don't realize how important it is for us to just live in the moment and take care of ourselves. And I know you've already heard about self-care, but self-care is so important. And I think during this COVID time, most of us realize just how much lack of self-care we've done. And so it's the little things that can make a difference. So we had to put processes in place so that we could all be on the same page. Anxiety increases when we do not know what our expectations are. So it's so important to get the team together and come up with plans and implement those plans. And you have to do it on a regular basis. It cannot just be one and done. These are things that you have to constantly meet about. I know you probably zoomed out, but it's so important that everyone is on the same team. And that will allow staff to trust leadership. So we know when there's a lack of trust, systems break down. Employees do not want to give their all, because of if the leadership is fragmented and we don't know what we're doing, and that definitely sets a standard for the rest of the staff. So being supportive of one another is really important. We had to actually bring in support from our other sites, our other clinics, because of the decrease in staff. And also that allowed some of our staff to take some time off. Recognition is really important. Having a smile on your face, just saying to someone, one of your colleagues, you're doing a great job, or how can I help you make your day better? Just that recognition is really important. Acknowledge staff accomplishments, whether big or small, just let them know that you care. If it's a staff birthday, acknowledge that. If they have some kind of accomplishments in their personal life and they want to discuss it, please, acknowledge that. We have weekly huddles. We were having daily huddles prior to COVID. But during the weekly huddles, we do try to acknowledge staff and celebrate one another, each other's successes and accomplishments. Kind words go a long way, as I said. We are all stressed out and beyond burned out. So just, remember just to be grateful of what we have, and just say a kind word to a person. You just never know what someone is going through. Allow staff to be part of the decision-making process. That is so important. We cannot, as leaders, make all of the decisions and not include the staff. I mean, we think that that's what we're supposed to do, but you'll be surprised if you allow staff to express themselves, whether good or bad, and then you grow on that. One person do not have all the answers, and we have to respect everyone's position. Whether it's the person who's cleaning our exam rooms, we depend heavily on them, especially in a time of COVID. So we all know that things are not going to go the way we want to 100% of the time. But team building during this time is so important. Allowing staff to have flexibility with their work time. We did, in the very beginning, allow most of our staff to work from home. And of course, because we are seeing more patients, we had to have the clinical staff come in more days. But if you have a staff member who may have childcare issues and they're able to work from home, maybe one day working from home can make a lot of difference for some people. And once again, self-care, I cannot express the importance of self-care. And thank you for listening. Terea and I welcome you all to ask any questions. And hopefully the information that we shared today was a little helpful. You're probably doing a lot of these things, but thank you.
Thank you both so much. And Dr. Mary and Terea, I have some questions for you. I also want to encourage folks to ask some questions in the chat. I have a little recap summary that I'll do in a minute, but before I get to that, just wanted to ask it, Dr. Mary, you had mentioned on your slide about FPCN that you have AmeriCorps members who are, or at least one AmeriCorps member, right, who's supporting you all. And I just wondered if you could speak a little bit about what that person does and how they help and support you.
Sure. So our AmeriCorps worker for the past couple of years have been helping seniors with insurance. So I'm helping them with the Medicare process when they are 64 and a half. And patients who are uninsured, we do have an outpatient service coordinator who also helps our patients who are uninsured. But this is what our AmeriCorps worker does. She focuses more on our senior population and help navigate the whole Medicare system.
Okay, thanks. Yeah, I shared the AmeriCorps link in the chat. You all might have experience with this, but especially in the vaccine rollout, we've actually found that AmeriCorps members can be really, really helpful. Certainly not doing clinical work, but helping schedule patients, education, follow up, like you were saying, Dr. Mary, like even certain populations, like doing work around that can be really, really helpful and may help, just given the staffing challenges right now, may help with that too. So just wanted to ask about that. And then for either of you, I think I remember one of you saying that there were sort of visual reminders in your clinic about some of the self-care pieces, or maybe the kind words. Can you talk about like, what does the physical environment of your health center look like? And do you have reminders throughout the health center to help folks and staff remember to, take those breaths?
We do. I'm gonna let Terea answer that.
It's a system that was started by our mind body team. It's, again, a little different now because of COVID and staff not being here. We did have to remove some of the things that we had in our clinical exam rooms. But what we have now are their gold stars that are around the building in different locations. So the gold stars are just a reminder for self-care to, you know, to think about yourself and do something in relation. A lot of it we talk about is deep breathing. And you know how Mary, when we started about self-care, she said, everyone take a breath. And that's something that we kind of harp on a lot. So even at our huddles and other meetings, we try to start off with doing some type of mind-body activity or exercise just to center ourselves and to kind of take a breath and have us relax. Because again, Mary mentioned, you know, the anxiety that exists and amongst most staff, or, you know, a lot of staff. And it may not show, but a lot of people just sitting and relaxing for those few minutes and just taking a few breaths is a big help for some of us.
Right. So
And in
Terea,
addition-
everyone knows that the gold stars, like when they see that, they're like, oh yeah, and it kind of would hopefully trigger them to maybe take that breath or reflect a little bit.
Yes, that's the goal.
Great, that's awesome.
And also, in addition to what Terea just said, we are a certified sanctuary facility. So we do have grounding techniques that we do. We all the employees carry cards around just to help them deal with stress. So we have about 3 to 5 different techniques that you can do in your private time, whether that's just walking away from a situation, whether it's howling and screaming somewhere, but just that time alone is very important. And we also start our meetings out with community greetings too, just to ask everyone, how are you doing today? How are you feeling? What do you get out of this meeting? So those are some of the grounding techniques that we express and welcome as well.
Wonderful. Yeah, I remember learning a lot about the sanctuary model from you, Mary, and Kathleen, who I think works at BCN too. And if folks are interested in learning a little bit more about that model, it's kind of about trauma-informed care, but also having a trauma-informed workplace, which I think can really help, especially during these times as well. I'm going to leave it open for other folks to type their questions or just some thoughts in the chat. I did want to shout out Randall, saying these are some great points and strategies. So thanks for pointing that out, Randall. I agree. I think, you know, we hear, oh, it's self-care, it's so important, so important. But a lot of times we don't want it to feel like yet another task, right, that we have to do in the day, where we don't even have time to do our regular tasks, right? So I just like that idea, Terea, like, you know, having those little gold stars in the exam rooms and just briefly, doesn't have to be a big 30-minute thing, but just briefly being able to take that breath. I think that's a really nice, nice takeaway for folks.
And
I wanted to wrap up. Oh, go ahead, Terea. Yeah.
I'm sorry, it was me. You can also put, because we have different quotes around the center too, different positive quotes that we have in exam rooms, out in the lobby, in the bathroom, just like common areas. We have positive quotes that we use as well.
Yeah, I love that. I think it sounds simple, but I think, you know, it really does go a long way to show that the environment is supportive, right? Oh, right. So Susan, can you provide, Susan asked if Dr. Mary, maybe you can provide more information about the cards that that staff carry around. What are they exactly? What do they say?
Oh, so go ahead, Terea.
Oh, I was just going to say, so the cards we have are actually our individual emergency plans. So basically for individuals to put their own, you know, emergency plan on something they would do if they are having a really stressful day or need to take a moment. We learned about that in some of our trauma-informed care trainings. So everyone that goes through, once they go through the sanctuary and trauma-informed training, they'll create their emergency plan card, and they're supposed to keep that on them or keep that somewhere close by, so that way either they can refer to their emergency plan, or if they need to check in with another staff member, if they say it's okay, they can share, you know, where their emergency plan is, so that the staff member can get that and help them out if they need it.
So Terea, is it more like, you know, people say, I'll take out my card and see, like, call mom or something, or, you know, go outside and do this? Like, is it sort of like tasks that they could do to help themselves during that?
It is. So it could be, you know, I'll take a minute myself and I'll go call my mom. So just like you said, if that's something that I feel like I would need to do at that time. I know for me, on my emergency plan, it was in relation to my dad who passed away 4 years ago. So my thought was to go outside and, have a conversation with my dad if I needed to, or just, reflect on, some good memories and positive things with my father to help me get out of a negative space if that's what I needed to do.
Love that. That's beautiful. Thanks for sharing. Thanks for asking that question, Susan. I'll also share, and maybe Lauren, you can share, you can dig around and look, but we did do a webinar last year with FPCN. I know Kathleen and Dr. Mary, I think you might have been on as well. And it talked a little bit more about the sanctuary model in general. And that, I think it gave a little bit of an overview of that model. So it might help to kind of look at that and just get some ideas that, you can incorporate, especially now as maybe folks are coming back into the office. Maybe that's something that a new initiative, right, that we can kind of think about. So, right, great, thank you. And we're gonna have more time for questions, and please feel free to put more in the chat. But I wanted to just quickly wrap up with some just key takeaways that, I had found from an article in Nursing Times, actually. And it really does resonate with what Dr. Mary and Treya were saying. So the article here, and it's linked here for you, talked about some of the things that nurse leaders can do to support their staffs, but really the same suggestions can be helpful for any health center leader. And now more than ever, it's important to enhance that crisis communication, which Dr. Mary talked about. It doesn't necessarily mean that there has to be more communication. So like she even said, they went from daily huddles to weekly huddles. So even fewer, like time-wise, less communication rather, but making sure that the communication that is happening is open and honest, not overwhelming. And as Dr. Mary said, nurses, but everyone at the health center wants to know what's going on, how can they support themselves and their patients, but they're constantly being bombarded and inundated with these messages about the pandemic from all over the place, from not only their workspace, but from home, from the news. So making sure that they know exactly what their responsibilities are, exactly what's expected of them. And if you don't know, like particularly, maybe with the vaccine, we don't know when patients are going to be eligible, just communicate that and say, we're going to make sure you're updated when we know that information, and just making sure that they understand that you're going to let them know and that you have their back with that. So Dr. Mary and Treya also shared some great communication strategies that you can incorporate into your crisis communications as needed. Again, that way to start the meetings, taking those breaths, I think is really great. It's also important to invite nurses and other staff to participate in the decision-making process during the crisis, like Dr. Mary said, and seeing the big picture while they're working out in the front lines. Sometimes you can't see the forest for the trees, right? And especially now when you're in the weeds, you're an essential worker, you're on the front lines. So helping them see the big picture, what you're achieving, highlighting successes, I think is all really important. This also includes leading by example and showing nurses and your staff that you as a health center leader are empowering them to join you. So I remember hearing on a recent roundtable, the health center leaders were the first in line for the vaccine. They wore their stickers, I got my vaccine, demonstrating that confidence, empowering their staff to feel comfortable to come to them with questions, concerns. Or even asking leaders like Dr. Mary, like attending those mindfulness sessions, demonstrating this is really important. Mindfulness is important, self-care is important, and having them demonstrate that, really, really important. And then to that end, talking about self-care, supporting the team emotionally by just acknowledging the shared trauma, the shared distress that we're all going through, helping the team cope in ways that are appropriate for them. Again, you heard about some of the gold stars, the cards, and that staff might carry around, just different ideas that you can incorporate here. So as I said, we are going to have some more time for questions, and I would love for folks, if you would like to, I don't know, Mariah, if people are able to unmute, but you can certainly unmute to ask a question. You obviously can type it in the chat and we can ask Dr. Mary. Yes, great. So Lauren, thank you for finding that webinar. I'm sure she was in there. So that webinar from, I think, last year, might have been February, a little bit before COVID, but that webinar is also about FPCN and talks about their trauma-informed model that they have for their staff. So it might be nice to revisit that and just get some strategies from there. Does anyone have any questions at all?
Emily, I wanted to share one other thing, and we actually forgot. We kind of touched on it. We talked about acknowledging like the successes and the wins. So one of the things we also do that's helpful during the vaccinations and the testing, the community has been so gracious, and it's awesome when when you're here and you're giving those vaccines and people are taking pictures and smiling and just thanking us so much. So we also like to share, usually in our huddle, if someone has a great story or just have heard something that some of the community or the patients have been saying during like the vaccination session, they'll just bring it back and start the session off with that as well, or just share it with the group so we can hear, how exciting people are and how grateful our patients are, as well as community members that aren't our patients.
That's great. That's great. While you all are thinking of questions and asking questions, Mariah's going to bring up an evaluation poll for you. Just briefly pop onto your screen for you to let us know your thoughts on this session. It really helps us improve future ones, so we appreciate you taking the time to do that. Any other questions from the audience, our ACU friends, anybody? My email is here. I'm not sure, Dr. Mary and Trey, if you're able to share your emails or if you're okay with that, but feel free to put those maybe in the chat for folks, maybe if they have a particular question for you. You can kind of do that, but I can also relay questions to them if you all want to email me. And then I also wanted to share, just as we're wrapping up here, that this, again, as I said, is the second webinar in a 3-part series. The third one is next week. Wait, no, it's not. It's April 21st. I was like, that can't be true. The third one is April 21st. It's about evolving care team models in the context of the pandemic and strategies to assess provider satisfaction. And we're going to be joined by our friends from CHC Inc. and the Weizmann Institute, who are going to share about their model up in Connecticut, which would be really, really interesting, really, really helpful for all of us. Oh, great. Thank you, Trey. There's Trey's email in the chat for you. So again, any questions for any of our speakers today? Sabrina says, thank you. Yes, thank you both. We're so thrilled to have you, Dr. Mary and Treya, both of you here to share some of your experiences. And, no one has all the answers, like you said, Dr. Mary, but it's just really helpful if we all just talk about this and hear just what's worked, some of the things that have worked and what continues to be a challenge, so we can hopefully work together to for some solutions to that. So I will give everyone a minute back of your day. It's 12:59 here on the East Coast. So I will go ahead and do that and close out the session for today. We really appreciate your time, really appreciate your attention, knowing that there's so much going on. Feel free to reach out to us with any questions. We're always available to do that. And so, yeah, we'll see you on the 21st for our third session. Thanks so much, everyone.